Hello guys, welcome to Mr. Coco's Nurses class. At this moment, we would like to look at the critical care bundle. Sometimes it's used also in general nursing, where you write about the resuscitation or in emergency cases. So you might have a question which has an emergency, then you can use the critical care bundle where you write the ABC or the CAB, which is called CAB, to resuscitate a patient. So just something quickly that we want to look at is now what we call critical care bundle. So let's try to see what we have under critical care bundle. So I have here with me what we call the air or airway. So under air or airway, what should you do as a nurse? So this is also applying to general nursing because it's the same, even if it's critical care bundle, but even to the nurses or who are doing general nursing or even midwives, you can apply this. So this is just a general emergency care. So let's see what you do first. So what you do first, we're looking at the airway. Okay, so when you look at the airway, we try to secure it, which was saying secure the airway, which is number 1 here. So we secure the airway. By securing the airway, it means that you need to first of all assess, see, is there anything in the mouth, perhaps secretions. Does this patient have secretions, or if it was at maybe the accident scene, is there anything that entered the mouth, or is the tongue falling back? So we need to assess. That's the first thing that we do, so that the airway is secure. Or then we need to also, apart from assessment, we need to remove, if there are dentures there in the mouth, we can remove dentures so that the airway is clear. Then what do we do to secure this airway? So you'd find that most people would say, let's do what we call head tilt, so that this head tilt will help to make sure that the airway is patterned or clear. So same as another technique we can do is a chin lift. Chin lift, you just lift this chin so that the airway is clear. Okay, head tilt, you just put your hand here on the patient, then you tilt the head just like that. So that's what we do with those techniques. Then once that is done, there is another thing that you can do to make sure that this airway is clear. Or if the patient, maybe you are scared that the tongue can fall back. You don't want the tongue to fall back, so the airway should remain clear. What do? You insert a device which we call oropharyngeal airway, which is oral airway. Some will say airway girdle or oropharyngeal airway, so that the tongue does not fall back. That's the rationale that we give. Okay, mostly this applies to the unconscious patients. So these patients may be unconscious. They might be having a lot of secretions coming out. So if they're producing a lot of secretions, you might want to also suction. So there's this part of suctioning whereby you just remove those excess secretions from the airway. So all this is being done to ensure that this patient has a patterned airway and the airway is so clear that they're able to breathe properly. Because once you do this, you're going to ensure that that hypoxia, or if the patient was hypoxic when they came, it's cleared, so that the patient is becoming stable at this moment. Then let's look at another thing that we can do to ensure that the airway is clear. We do what we call a position of 30 degrees. Okay, so this position, 30 degrees position, is whereby the patient is lying in bed, and then you put a pillow to ensure that there is that 30-degree angle, and then this patient will not be able to aspirate, or even the secretions won't go back into the airway. Okay, so this angle helps us maybe the patient not to aspirate, because remember that this patient was come in an emergency, also ate, so the stomach may be full. So the gastric content can be regurgitated and go into the airway, so the patient might aspirate. So we don't want the patient to aspirate, so let's position the patient in this angle, 30-degree angle, as they lie down, so that they do not aspirate. Then let's go to another bundle, which is B. So when you look at B, B represents breathing. So as you are there as a nurse, you'll be able to assess. When you look at the chest, obviously you'll be able to see the chest movement. Is the chest movement equal? Meaning you compare the right and left side. Is the rise and fall of the chest equal? So that's during your assessment. And then as you are doing that, you might want to give oxygen. Okay? So you might want to give humidified oxygen, which is 100%. That's what we call it. So 100% oxygen, you might give it. You might give it via mechanical ventilator, okay, because that's what can provide mostly 100%. Okay, so the mechanical ventilator starts from 21% to 100%, so it can give you 100% oxygen because this patient might be hypoxic. So you might want to give this humidified oxygen during this process of breathing. So you can also use other devices. So let's look at the devices under breathing which you can use to give oxygen. So number one, we have the bag and mask. So that bag and mask, it's that device whereby you're bagging and then there's a mask. So that as you're bagging, there's a mask there. You're trying to provide oxygen to the patient. Then you can also give oxygen via a CPAP. Okay, it's also a device which you can connect to the mechanical ventilator. Okay, so that oxygen can go to the patient. Or you can use the mechanical ventilator itself to provide adequate oxygen. So as you are doing this, you can also monitor the patient using a pulse oximeter. So you can use a pulse oximeter to monitor the oxygen saturation. Okay, so it's also very, very important to do that. Then let's look at another bundle, which is C. So C represents circulation. So this also can differ depending on the situation. If you are dealing with a patient who has lost a lot of fluids, you start with CAB instead of ABC. So mostly in diarrhea like cholera, you might start with C. So the sequence will change. Instead of ABC, you go to CAB, meaning you start with circulation. What you might want to provide fluids in this case. So that's why I start with the C. So let's look at what's involved in C. So under C, what we have is we have you assessing the patient. So under C, you are assessing the patient by feeling the carotid. So you might want to feel the carotid pulse. So the carotid pulse, because it's an emergency, you don't want to go to the brachial, you don't want to go to the femoral, you want to go to the carotid, which is there. So you might want to just feel it at the angle of the mandible so that you try and assess how is the pulse. Is it something which is feeble, or is it something that you can't really recognize, or you can't feel it pulsating? So as a nurse with your experience, you might want to know, this is a full-bound pulse that I'm able to feel, okay? Or what is the type of this thing I'm able to feel pulsating if you're not sure. So you can be able to at least go there and feel. So you need to feel for that strength. You need to get it. The intensity has to be there so that, this is a full-bound pulse, meaning the heart is working. But if you can't feel anything and you're experienced enough to say, okay, this is where the carotid pulse is, and you can't feel anything, meaning that the circulation is not okay, meaning the circulatory system is collapsing, so you need to act very fast. And what other things can you do? You can also go for the capillary refill time. The capillary refill time, for those of my friends who might not know, it's whereby you get this finger of a patient, then you press it. You can press it just maybe for even just seconds, just for a few seconds, press it. After pressing for a few seconds, then let go. If you see it becoming from whitish to pinkish within 2 to 3 seconds, meaning that the perfusion in the peripherals, meaning the fingers, the legs, it's okay. But if it's not happening, meaning that there is no good circulation in the peripheral areas or the extremities. That's why we use CRT. Then apart from the assessment, now you might want to take action because you have assessed. Now you want to take action. What do you want to do in terms of taking action? You want to at least now cannulate the patient. So when you cannulate the patient, depending on the age of the patient, if the patient is an adult, you might want to go for a bigger cannula. So you might want to put a 16G. Sorry, I wrote 14. You might want to put a 16G. You might want to put an 18G, and maybe depending on the size also of the veins. If a 16G, 18G cannot allow, you can even put a 20G. So depending on what you have assessed. So after you put a cannula, what should you do next? You have to now give fluids. So in resuscitation, mostly some people would say, okay, let's give isotonic fluids, such as sodium chloride. Some would say ringer lactate. So you might want to pick isotonic fluids to resuscitate this patient because you're dealing with the volume. You want to improve the volume, okay, of blood. So let's now go to hemodynamic monitoring. Hemodynamic monitoring meaning you just monitoring the heart rate, okay, the blood pressure, the mean arterial pressure, central venous pressure, then pulmonary arterial wedge pressure. So all these, we are just monitoring how blood is flowing into those blood vessels and how the heart is pumping because you are giving fluids. So you need to continuously monitor the patient in real time. What I mean by continuously monitoring the patient in real time is that you're going to use cardiac monitors. You're not going to rely on maybe say measuring blood pressure after 4 hours. You can't rely on that. This is an emergency. So you're going to connect this patient to a cardiac monitor and then monitor, at least do continuous monitoring. You can set even the maybe blood pressure every 30 minutes. You can't do blood pressure maybe every after maybe say 10 minutes, 15 minutes, or even just say 2 minutes, because it will be very uncomfortable for the patient. But cardiac monitoring will be done continuously. But for the blood pressure, at least you can set time, maybe 30 minutes, every 30 minutes you're monitoring. Unless the patient is going into a crisis, then you can reduce the time. But if the patient is not going into a crisis, at least you can set 30 minutes hourly. That will help, and it won't be very uncomfortable for the patient. So the next bundle that we're looking at is D. Under D is disability. So disability, we're looking at now the damage that has been caused. Okay, so the damage that we're looking at is a neurological damage. We're looking at now, has this problem caused any damage maybe to the brain because there was hypoxia, there was hypovolemia. Has this caused any problem or damage to the brain or to the nerves or just even to the eyes? What has happened to the nerves? So those nerves supplying the eyes, the mouth, the GIT, anything you need to assess so that you know if there's any damage in the body that has been caused by this maybe hypoxia or hypovolemic shock that occurred, or any damage or any reasonable cause for this problem. Has it caused any complication? That's what we're looking at here. Okay, so then we go to E. E is now whereby you have done the ABC. Okay, you've given the fluids, you've given the oxygen. Now you're now going to examine. You're trying now to continue examining this patient. So you want to examine this patient. That's what I'm saying, exposure and examine. So now you're going to examine. So what do you do? You remove the clothes and examine thoroughly. So you need to now examine fully. You want to see what does this patient also have apart from what you saw or what they came with. What does this patient have now? So that's what we really want to look at as well. Then apart from that, as you are trying to examine, you need to bear in mind that this patient has to be kept warm. So keep the patient warm. That's what we are looking at as well. Then other issues that we look at would be F. F is called further investigations. So under investigations, what do you do here? You need to do a baseline hematologic examination. This is under hematology. You do HB, You can also do a white blood cell count and differential. So you can do a lot under hematology. You can also do the urea and electrolytes. You can do the liver function tests. You can do the blood slide. So you can do depending on the hospital. Some hospital even do C-reactive protein just as baseline. So it depends with the institution. So you can do the investigations according to your institutions. Some would even order chest X-ray, scan, and all that. So it can depend upon the institution. Okay. From there, we can do the G. G represents glucose control and gastric protection, because we know that this patient is in an emergent state. This patient might maybe have starved, and they might have not taken anything by mouth. So when the gut hasn't received any food, which is the stomach or the GIT hasn't received any food, you might find that the hydrochloric acid will start working or chewing on the mucosa. So you need to protect the mucosa. So what do we do to protect the mucosa? That's why we've put PPIs here, such as omeprazole. So you need to protect the mucosa. So give the patient omeprazole. Some institutions will give rabeprazole. So give a PPI. So that's how you protect the GIT, because the patient might have not eaten anything. Okay. Then another issue is that you can also feed what we call enteric feeding, meaning that you can also put an NG tube, because the patient might be unconscious and cannot feed orally. So you can provide or you can insert an NG tube and provide the feeds there. Okay. Don't keep the gut without food. That's what we mean. Then apart from that, you need to monitor the glucose levels. So the glucose levels can be maintained between 5 to 9 millimoles. So you need to maintain the glucose levels. So you need to be doing AccuChecks, or some say you need to get a glucometer and check the blood sugars on spot. That's what we need. Then we move on. We move on to H. H is hematology. So under hematology, what do we do? Meaning that we're looking at the HB. Okay. So when we check the hemoglobin, we need to at least maintain it at 8 grams per deciliter, meaning at least that's the minimum that we should maintain it. Then it has to go up to the normal ranges. Okay. Then we can also do something like we can test INR, which is we are looking at the blood clotting mechanisms. So you can try to correct these clotting mechanisms by giving anticoagulants if there is any clotting happening in the body. So you need to test the patient for these clotting mechanisms. Okay. Apart from hematologic, you can go to infection and immunology. So so this T, it's not a T, it's supposed to be I here, which is supposed to be infection and immunology. So meaning that as you do all those procedures, the nursing procedures you're doing, okay, such as injection giving, catheter care or catheterization, you need to consider aseptic techniques, meaning that you need to try by all means to at least use aseptic techniques or sterile techniques. Apart from that, you need to protect the patient from bacteria or bacterial infections, because this patient is very sick and susceptible to microorganisms. So you need to start the patient on antibiotics early so that you just protect this individual. Okay. Then you go to J. Okay. J is judge yourself. So in judging yourself, what do you do? Okay. So the first point is that you're going to say, have you done your best for the patient? Okay. Or is there something else you could have done to help them? That's the first thing. Have you done the best as a nurse? Because we know that you're supposed to provide the best care. But what you did, was it the best care that you provided? Okay. Then the second point is that what would you have done differently if that patient was your brother, your sister, your mother, or your father? What would you have done differently? what care would you have provided? So this is very interesting, and some people will call it the A to J bundle. Okay, so let's provide that care. Let's be practical. Let's put it in practice so that at least we be the best nurses that we can be. So thank you very much for watching, Mr. Coco, and keep learning and provide that best care. Thank you very much and have a pleasant day.